Good afternoon, everybody, and thank you for being here. Appreciate the public for tuning in on their television or their radio or their computer, however they happen to be watching. I've got with me today, as usual, Dr. Alex Beu. He will be here to present some information in just a moment. We also have State Fire Marshal Butch Browning, who will be here to answer any questions you might have that pertain to what he's been doing with Open Safely. And that'll become more apparent in just a moment what we're talking about. And I know that everybody is anxious about today's announcement, so I'll try to get to it. After discussing the data with public health experts in the Department of Health, with epidemiologists and the Resilient Louisiana Commission, and really reviewing the data that we've been accumulating over the last couple of weeks, we will be moving to phase one on Friday, May the 15th. That is this Friday. And so we will be lifting the stay-at-home order. The next proclamation will likely be issued on Thursday, be effective Friday. And we intend to leave it in place for 21 days, which I think is June the 5th. And so the next time that we anticipate having an announcement like today will be on Monday, June the 1st. And obviously we won't know what that announcement looks like until we get there and have the most recent data to look at. Obviously, like all decisions, this one involved a lot of time and work. And I want to thank the folks at the Department of Health, especially Dr. Beu and his team. We wanted to make absolutely sure that we were following the CDC vetted plan that was issued by the White House Coronavirus Task Force and President Trump's phased approach to reopening the country. And I do believe that we are striking the right balance with this plan. And that balance obviously is between public health on the one hand in this public health emergency and re-engaging more of our economy, getting more of our businesses open, employers back to work, customers in our stores and restaurants, and so forth. Well, you're going to get some more data in just a moment that's broken down in different ways from Dr. Beu. But I can tell you that statewide we meet the threshold criteria established by the White House based on declining COVID-19-like illnesses being presented to the hospital emergency rooms, based on cases. And you'll see in just a moment that's particularly true with respect to cases as a percentage of tests administered, which is one of the White House criteria, and with respect to hospitalizations. In addition, as we outlined on Friday, and this too is part of the President's plan, we now have more testing capacity in state. And in fact, in the first week of May, the federal government fully met their commitment to resourcing the state with collection kits that will allow us to get to 200,000 tests per week. I'm sorry, per month. That would be a tall order per month, and so we feel much better about that as well. And that capacity that we have for testing and for contact tracing that will be in place by this Friday greatly exceeds that which was available to us a couple of weeks ago. The bottom line is the people of Louisiana have worked really hard since this public health emergency was first announced in order to slow the spread of COVID-19. And I am proud and I want to thank the people of Louisiana for doing that. They committed to and complied with the stay-at-home order, and had they not, we would not have seen the progress that we have been able to see. I also want to remind everybody that until Friday, the stay-home order is still in place. So as I mentioned, Dr. Beu is going to come up in just a moment, but I did want to explain a little bit more about what phase one will look like. And again, we're doing this on Monday so that we have an opportunity to answer questions throughout the week. The proclamation will be issued on Thursday, effective on Friday, and I'm encouraging people to read the proclamation itself because it will be a complete document that will give you links to different places that if you need to go see certain things, such as we will still have 3 categories of businesses in Louisiana. Those deemed essential by CISA, the Cybersecurity and Information Security Agency that works in the Department of Homeland Security at the national level, they're on their 3rd edition of what constitutes essential infrastructure. And we have embraced the full scope of those businesses that constitute essential infrastructure by CISA. They will continue to operate as they have without restrictions as to the number of persons that can be present and so forth, but they do have obligations, obviously, to employees and to customers with respect to public safety and social distancing, the use of PPE and so forth. Then you've got a second category of non-essential businesses. I'll get back to those in just a moment. And then you've got a third category, and those that are closed businesses. Now, there will be fewer of those, but there will still be business types that will be closed in Louisiana. For example, during phase 1, tattoo parlors, massage establishments, spas, amusement parks, children's museums, bars without LDH food permits, they will remain closed. In the second category, that's everything in between. So if you're not CISA, if you're not essential infrastructure under CISA and you're not one of the closed, you're in the middle, just like we had a middle before, but the middle is going to be larger because there will be more businesses that will be allowed to open, and they will include things like hair and nail salons, gyms and fitness centers. But there will be restrictions in place. Most notably, these businesses will operate with a maximum occupancy of 25% and must practice social distancing. And in fact, the 25%, that is so that we know that they can practice social distancing when they open. There should be enough square footage in the establishment so that individuals can stay 6 feet from one another. Further, employees interacting with or in close proximity to customers will have to wear a face mask or a face covering. As I mentioned, I expect that the proclamation that moves us into phase 1 and ends the stay-home order will last for 21 days through June the 5th. The next anticipated announcement will be on June the 1st. And I also want to note that as we made decisions about things like salons and gyms, we received input from the Resilient Louisiana Commission task forces, but also from the different trade associations about protective measures that they will put in place for the safety of their customers and their employees. And we fully expect that they will be cautious, as they have been all along. And that is why, at this time, I feel that it is safe to take this next step statewide and not doing it on a regional basis. I know that there are a lot of different business uses and building types out there, and we're aware that for some, the new guidance is not as simple to apply as it may be for others. And every business owner and faith leader should read the proclamation closely to understand how it applies to them when it is released later this week. And I would remind the business community about opensafely.la.gov. opensafely.la.gov. This is a resource that will provide additional guidance that will be more applicable to your business use and building type to help you to establish how many people you can have inside at a certain time. And once you register, you will be notified as guidance evolves. So as we move from one phase to the next and the guidance changes, you won't have to go looking for it. It will be sent to you once you register. If you're trying to understand what the 25% means, know that occupancy capacity is based upon gross square footage and the particular use of your building. But the 25%, generally speaking, is designed to allow 6 feet between people and 10 feet between tables. We're still going to encourage you to closely interact only with members of your household. And so if you were going out to eat at a restaurant and dining in, for example, you and your immediate household could sit at one table. But you need to be at least 10 feet from the next table so that you have 6 feet between people. And what you cannot do as a business or a church or something like that is say, well, if I'm limited to 25% of my occupancy, I'm just going to put them all in 25% of my square footage, because that doesn't work. And so that we're trying to do this as safely as we possibly can. The capacities do include customers and employees. Now, obviously, the square footage doesn't include outdoor or patio seating that many establishments have been utilizing over the last couple of weeks. So social distancing for outdoor and patio seating will continue to be required. I know that this is different for our businesses and different for the public than the way we operated before the public health emergency, but it is required if we're going to cautiously move forward while giving our businesses the ability to serve more people, bring in more of their employees, while also keeping everyone safe. And again, the occupancy guideline is based on science, and it's in line with the White House guidance for phase 1 that calls for strict physical distancing protocols. And speaking of phase 1, I don't believe there's any distinction to be made between what's in the proclamation on Thursday, or what will be, and what was in phase 1 of the White House guidelines. So we've embraced those guidelines, and if there's a distinction to be made, it's that we moved early in some areas, like the resumption of non-emergency medical procedures and surgical procedures, and a couple of other areas as well. So the guidance to the examples that I just gave can be found by visiting opensafely.la.gov to get that information to prepare your business. And I do want to make something very clear, because I think there's been some confusion about this. With the exception of gaming establishments, no church leader or business owner is required to register or to get approval on their plans in advance of May 15th in order to open. So you don't have to go there and register with the fire marshal on opensafely.la.gov in order to open. We're asking that you do so if you're a business, so that you can get more information sent to you automatically without you having to ask for it. As we look at the latest numbers, I would ask you to keep in mind that they're typically lower on Mondays because we're reporting testing that came in over the weekend. I also want to point out that we had an issue with the server on Friday, which is why I think we were late updating on Friday as well. And so the way that played out on Saturday, we had a larger number of tests and positive reported than we had over the previous several days, and we're fairly certain that about half of Friday's results were reported on Saturday. So if you just average those days out, you'll see that things are pretty level overall, and that issue has been resolved. So getting to today, we have a report of 215 new cases, and that was on a daily total of 4,958 tests. Those 215 cases bring us to a total of 31,815, and you can see that we updated today the number of people that are presumed recovered at 22,608. And so you've got about, 9,200 or so active cases among those around the state who tested positive. Now, again, these numbers do not include people who have never been tested. And there's a certain percentage of people out there with COVID-19 who are asymptomatic or mildly symptomatic, haven't been tested. And so the amount of COVID is certainly in addition to the cases that you see on the board in front of you. Sadly, we have 29 new deaths to report for a total of 2,242. We have now conducted and reported almost 221,000 tests in the state of Louisiana to date. So with that, I'm going to yield the podium to Dr. BU. He's going to come up and discuss the latest data. Once he is done, He will take questions about any of the data he presents, and then I've got the fire marshal here with additional information should y'all have any questions for him, and then I'll be back in just a moment. Dr. Bia?
Thank you, Governor. So I'm going to walk you through some of the data that we looked at, and then talk a little bit more about Phase 1 as we prepare for transitioning into Phase 1. So just as we did 2 weeks ago, the team at the Department of Health, the Office of Public Health, including our epidemiologists and internal experts in biostatistics, met with academic partners from Tulane, LSU, and went over the data that we have, some of which we're going to show you here to understand the trends that we're seeing in the three gating criteria for cases that we are looking at, or for the epidemic that we're looking at. We'll go to the next slide. And so first wanted to just represent where we were on the 27th. This was the slide that we had shown to you, I think, on April 27th, after we had the initial discussion. And what we had conveyed at that time, looking at the data, was that COVID-like illnesses, people presenting to emergency departments with symptoms of COVID as a percentage of all ED visits, were decreasing across the state. Cases, per our assessment at that time, were increasing in a few regions, Region 2, Region 4, and Region 8. And then in Region 7, the Shreveport area, we were seeing a general plateauing in cases at that time. And perhaps most concerning to us, we saw an increase in hospitalizations over time in Region 2, the Baton Rouge capital area, and Region 8, the Monroe area, as well as plateauing in what we were seeing in hospitalizations rather than a decrease in the Southwest, in the area around Lake Charles in Region 5, as well as in Shreveport in Region 7. When we looked at the data 2 weeks later, what we see is generally improvement in trends. When we look at syndromic surveillance, so that COVID-like illnesses, we did note that in central Louisiana, the area around Alexandria and really covering Cenla, did seem to show a plateau in people presenting to emergency departments as a proportion of total emergency visits. However, overall, the symptoms were down for COVID-like illnesses across the state. Cases, here we saw only two regions, Region 6 and Region 8, so again, Cenla and the Monroe area, where we saw an increase in cases, just looking at actual cases reported and the epidemic curves, and I'll show you some examples of that in a moment, as well as a general plateauing at the state level overall, and specifically in Regions 2, the Baton Rouge area, and Region 9, the North Shore and Florida parishes. We'll talk a bit in a moment about why that could be, and we've talked previously, I think, in these press conferences and in other engagements about the fact that the last 2 weeks also coincides with an increase in testing overall in the state, and our assessment as we were looking at cases was definitely taken into context the increase in testing. I showed you some of those numbers on Friday, as well as the general decrease in the percent of positive cases per test performed. And I'll show you a graphic that kind of depicts that. But in general, what I'm saying is we did more testing, and fewer of the test results that came back were positive. So while we were seeing overall cases expand, we did think that some of that was a function of having more testing in the state. And along those lines, as we continue to have more testing, I would expect that to be the case in multiple regions. When we turn to hospitalizations, we did see that Region 2, where we had previously seen an increase, now is in a decreasing trajectory. And Region 5, the Southwest, where we had previously seen a plateau, has now also started to decrease. Region 8 continues to increase on its previous trajectory, and Region 7, where there had been sort of a plateau in hospitalizations, we see an increase. And I'll take you through some graphs to show you a little bit of what we're looking at on the next slide. This is a depiction of what we look at the state level. The top graph is depicting this percentage of COVID-like illness syndromic presentations to the emergency department as a proportion of total emergency department visits. You can see that certainly has a peak that comes up towards the beginning of April and then has been coming down statewide since that time. The middle chart is an epidemic curve. Here we're depicting the change in new cases being reported as an average, 3-day running average over time. And the colors really depict whether that change denotes an increase or a plateau from the previous day. So that's why you see colors shifting. The brown color showing that you're seeing an increase, you're seeing growth. The purple color meaning you're seeing essentially plateau. There's not a significant change in the number of new cases reported across those days. And then where you see that sort of light purple, maybe blue, depending on how you're seeing it, color in the middle, that's where we actually see a sustained decline. Now, I'll note that in addition to epidemic curves, we also look at total testing that's being performed. We look at the number of positive tests as a proportion of those total tests that are being performed. This is just one way to depict how we sort of look at cases at the state level. And here you can see that there's been this sort of undulating growth to plateau pattern. Most recently, again, in the context with a significant increase in the amount of testing statewide. Hospitalizations may be a little bit easier to interpret as a graph. This is the 3-day running average of total daily admissions to the hospital where somebody is admitted, people in the hospital with a diagnosis of COVID-19. And as you can see, that's been on relatively steady, albeit not steep, decline over time. Previously, we know that the first hot spot in the state, and certainly the hottest spot in the state, and one of the hotter spots in the country, was the Greater New Orleans area. And so what we see when we look specifically at Region 1, the Greater New Orleans area, is really a largely good story here. We're seeing that the syndromic surveillance of symptoms have been coming down steadily since a peak. We've seen the cases also coming down, obviously some plateauing, especially as we've seen some increase in testing in that region, and that's one of our more robustly tested regions. And then hospitalizations, again, a steady decline, even steeper than the overall state decline. Region 1 continues, it had much higher that went up, much farther to go, but it seems to drive a significant amount of the improvement in hospitalizations. I did want to highlight, though, the two regions that still give us some concern. We'll start with Region 7, the Shreveport area. And while we see that symptomatically we're seeing the same decrease that we saw in other regions and statewide, that people are presenting to emergency departments in Region 7 with fewer, as a proportion, fewer COVID-like illnesses, when we look at cases, you have this sort of, again, rolling plateau, maybe slightly decreasing trend in cases. And again, if we look at the last 14 days or so, we think that's probably decreasing. What I think is important to point out is Region 7 is another region that has a fair bit of testing going on. So this is in the context of a fairly good testing in that area as a percent of total population. Hospitalizations-wise, though, you can see what we were looking at before, where you have this plateaued graph, but then that tail most recently where there's been steady increase over the last 2 weeks. Now, that steady increase is definitely there. I will note that just given that the numbers in the region, the population is a little bit less than Region 1, what's being depicted there is actually an increase of about 44 total admissions over the last 2 weeks net. So it doesn't mean that there are hundreds of people in the hospital showing up each day more and more. However, I will note that we have about 380 admissions between Region 7 and Region 8 that were added net during the last 2 weeks. If we look at Region 8, we see, again, a similar sort of a little bit noisier plot when we're looking at syndromic surveillance, because, again, it's all about the volume of tests. The greater the numbers are that are showing to the emergency department, the smoother that curve will be. So in general, we see smaller numbers of people presenting to hospitals or emergency rooms, and it means for a choppier graph. But the general trend is down for symptoms. However, when we look at cases, especially looking via the epi curve, what we see is this sort of stepwise increase to plateau pattern. Again, we've been increasing significantly the amount of testing that we've been doing. We've been doing more testing, especially in the parishes that border Mississippi, and we'll continue to have even more sites there, like in East Carroll, Madison, and Tensas. And so we'd expect that there may be some flattening of the trend here in Monroe, though we hope certainly that we see an increase or a decrease over time. Hospitalizations, however, we've been seeing this stable increase, again, with some movement around this trend line that shows the last 14 days. Again, just to emphasize, while this trend is increasing over the last 2 weeks, that's a net of 4 hospitalizations. People are coming and going from the hospital, being admitted and discharged, but on the whole, there's been an increase of 4 net cases over that last 2-week period. And so 4 hospitalizations net can be absorbed by the health system in the greater Monroe area, same as 44 being absorbed by the hospital system in Shreveport. But I think what I want to really sort of convey here is these are trends, and we're watching them closely. And especially as now we're taking steps to relax restrictions, it's really incumbent on all of us, especially in these regions, to take seriously the opportunity to social distance, to wear a mask, to stay home if you're sick, and as we're going to see as we surge contact tracing into these areas, to work with us on abiding by an isolation or quarantine recommendation, and stay in your homes for that 14-day period as requested, because we don't want to see these numbers rise to crisis levels. So I'll move now to talking a little bit about phase 1. The governor already highlighted many of these. Oh, sorry, I skipped a slide. I promised that I was going to come back to this idea of percent positivity. So again, as we presented on Friday, we've been increasing the amount of testing going on statewide. And this was the same graph that I showed on Friday, where we've seen week to week there's been a significant increase in the amount of testing at a state level. The blue bars are the total testing going on. The orange bars are the positive values, the actual cases that are being reported out of that testing. And what you can see is while there's an upslope in the blue graphs, there's a downslope in the orange, meaning that the percent that's positive is coming down even as we increase testing. We don't depict here last week where we had over 39,000 tests done, and there the percent positive would also be lower. So that general trend makes us a little bit more comfortable about what we're seeing in the epidemic curves, where we're seeing these increases or plateaus in different regions. We have to take all of that into consideration, and certainly encourage members of the press, where they have questions, to engage with the academic epidemiologists around our state, who have a tremendous amount of information and knowledge, and can give you the same assessment that we had when we looked at this data, which is it is complex. Next slide, I will now talk a little bit about what is in phase 1. And so again, through the Resilient Louisiana Task Force, the Office of the Governor, and looking at the White House guidance, the following are in the phase 1, safer at home, and can open with limitations, 25% occupancy, sanitation, and really critically, that 25% needs to be to accommodate spacing, to accommodate keeping individuals 6 feet apart from each other if they're not from the same household, tables 10 feet away from each other so that there's room for people to walk by without causing problems. And so here you have churches, solo and non-contact sports, barbers and salons, as the governor said, museums, zoos, and aquariums, especially where they don't have tactile exhibits. So if you're keeping space in between the party in front of you and behind you, you're not touching things, you're wearing masks, sanitation and symptom checking is happening at the entrance of these facilities, we think that these can open. Gyms and fitness centers in malls for stores with exterior entrances, they'll be able to have people coming in as well. Restaurants, coffee shops, cafes, bars, breweries with an LDH food permit, with people seated at tables. There will not be standing allowed in these facilities. So the capacity will be managed by having to be at a table, and again, those tables need to be spaced. Theaters, casinos, video poker, and then racetracks, notably racetracks with no spectators. I do want to point out that though we are opening up these facilities on the next slide, I want to reemphasize that does not mean that everybody in the public should go out and enjoy these open businesses. We certainly want the businesses to reopen and to thrive, but we want to continue to message to the public that if you are in a high-risk group, if you are 65 or older, if you have significant underlying health concerns, the risk from COVID still remains, and you need to take measures to keep yourself safe, and certainly would recommend that they not go out, that they stay home at this point as well, because there's still a significant amount of COVID in the state, more than 9,000 active cases based on our estimate of the recovered as of today, And so the risk is still remaining there for COVID. And we want to make sure that those individuals at highest risk are taking control over keeping themselves safe, and their family members who are part of a household with those individuals should also be thoughtful about the risks that they take and then bring back to their home. On the next slide, I think what we wanted to emphasize is that what we're talking about here is not a return to pre-COVID, Louisiana. What we're talking about is a new normal. We're talking about wearing masks, encouraging each other to wear masks, because that's how we keep each other safe. It's not how I stay safe wearing a mask, it's how I do my part to keep you safe by wearing a mask. We want to make sure that people continue to monitor themselves. If you have symptoms, if you're ill, stay home. Contact your healthcare provider. Seek assistance. Don't go out and do unnecessary visits. Don't go visit a restaurant if you're symptomatic. We are going to do our part at the state level through contact tracing and testing, really increasing the opportunities for people to be tested in their communities, increasing our capacity to then leverage the contact tracing infrastructure we have to reach out to people who test positive, find out who might have been exposed, reach out to those people and encourage them to quarantine for 14 days. Our systems will only be as effective as the public complies with them and adheres to them. Out of a desire to stop the spread, out of a desire for us to move into phase 2, we all have to take that upon ourselves. And that's something that we can do as citizens for the state. And again, wearing masks in public, staying apart from each other, and staying home with sick are key components of that. There's a lot of information that we've just conveyed, a lot of information and questions that people will no doubt have. So on the next slide, we just want to highlight for the general public, 211 has been our trusted resource since the beginning of this epidemic. We've encouraged you, members of the public, to reach out to them. We continue to give them updated guidance. They continue to be your best resource for questions, especially about your local neighborhood. We also have coronavirus.la.gov. And we will be putting guidelines also on ldh.la.gov/coronavirus. For businesses, the Office of the State Fire Marshal created the opensafely.la.gov website, which has a wealth of information for businesses that should be practical, meaning if you go there, you're registering for your business, you'll get information that helps you understand how you can keep your patrons safe, which is what your patrons are going to want to feel comfortable coming back to your facility, and it's what we can all do to make sure that we continue to open safely and we don't risk having to pause or go backwards. And so as the governor said, we'll continue to monitor the data over the next 21 days and hope that we continue to see improvements, if not even greater improvements over time, knowing that we're also doing our part through contact tracing and testing. Thank you all. So I'm happy to take questions. Sam.
Dr. B, when you guys announced 2 weeks ago that you were extending the order, you pointed to a very similar chart that you put up a few slides ago, and the increases, the plateaus. I'm wondering why, when we had those red increases and plateaus in various regions, 2 weeks ago that meant we couldn't reopen. Today we still see those. It seems to me like we maybe aren't meeting the 14-day thresholds the White House recommends. So why are we still allowed to reopen now? The White House guidance?
So I think what I was trying to convey when we went through that spreadsheet, through that table, is that certainly if you look at cases, you see that there's more plateaus listed. I think that there are actually fewer increasing parishes. But more importantly, what happened over the last 2 weeks, we significantly increased the amount of testing. And you saw that in the bar graph, where we understand that as we increase testing, we're going to see more cases known. And so what we present in that table is the truth, that we are seeing plateaus in cases there. We're seeing increases in certain regions. I think, though, when you then have to assess what does that mean for moving forward, we have to look at that in a bigger context. And I think we've had this discussion come up during press conferences before. Well, and actually in committee in the legislature, as we increase testing and we see more cases, does that mean that we will forever be shutting down the state? And what we've always answered is no. We also need to look at what's going on with people presenting to emergency departments with symptoms and what's going on with hospitalizations. And both of those are rosier pictures than they were 2 weeks ago. Even with the plateau in symptoms in Region 6, overall, the state continues to show a downtrend in the other regions. And when you look at hospitalizations, yes, certainly we are not happy that Region 7, that the Shreveport area, saw this trend from plateau to increase. But there were other regions that were concerning to us previously for plateau or increase in Region 2, a much more populous area, and those have changed to decreasing. So the challenge, I'll say, from our perspective in public health and with talking to public health experts, is there is no playbook, even with the White House guidance, there's no playbook on how you can deem that your state is 100% ready to reopen. But what we need to look at is, overall, do we see the trends in the right direction? Do we think that that trend is in the right direction with, frankly, less adherence to stay at home, which is another consideration that we had in our discussions as well. We know more people are out and about over the last couple of weeks because we've been encouraging people to go out and about and enjoy the outdoors. We've seen more traffic on the roads. And so if we're still seeing these general trends decreasing while we're seeing more activity, it's a heartening sign. Even if you just look at the actual metric, it says something like increasing. Melinda.
Outside of the occupancy limits, are there any other limits on the size of public gatherings? I know, obviously, under the stay-at-home order, it's been 10 people. Are those kind of limits being extended in any fashion, or is it just the occupancy rate?
So for gatherings, we're still recommending small gatherings. For facilities, we're giving the occupancy level. Is that?
So there will be no. I mean.
I don't think there's going to be any change to the gathering guidance in this phase. The occupancy level is for people who are now coming into establishments where we're controlling the amount of spacing, the symptoms checks at doors and the like.
And I think this is a question for the governor, but I'm already seeing some criticism from various business groups about the 25% occupancy limit and the idea that some businesses they can't afford to reopen if that's all the space they're going to have.
Yeah, well, that's obviously unfortunate, and the goal isn't to keep them from reopening. It's trying to balance safety on the one hand in light of this public health emergency and the need to open more stores and get people back to work and get more customers into these stores and restaurants. And if you look, I think I haven't done an exhaustive analysis state by state, but if you look at them, 25% is pretty common across the country. And in states that never reached the level that we did in terms of our cases per capita and the type of hotspots that we've had around the state, principally in New Orleans and in Jefferson Parish. But that 25% is designed to allow for the strict physical distancing, social distancing that is called for in the White House guidelines. So it wasn't arbitrary. It wasn't some number that was just picked out of the air. It corresponds to the square footage of the business and trying to make sure that people can engage in those businesses safely. I would point out a couple of things that on the Safer at Home slide for phase one that Dr. BU went through. The 25% limit on solo and non-contact sports doesn't apply to the team, so you don't have to field 25% of a baseball team. For example, but it does apply in the stands, and so obviously if you're outdoors and you can spread the spectators around the outfield and the sidelines and so forth, then that'll be fine. So with that, I'll take more questions. Yes, sir.
Governor, under what circumstances would it cause you to roll this back? I mean, you're obviously going to keep monitoring it. There's a chance you said it spike COVID's still here. What would you have to see to roll back these?
Well, we're looking at the data every day when it comes in, and if we saw a spike in cases and that was more than you would expect to see just because you were increasing your testing capacity, that actually caused an increase in hospitalizations, then you've got to take a real serious look. And you got to try to figure out, is this something we can keep a lid on because of the additional testing capacity and the contact tracing capacity that we have? And we'll just be talking about that as we go with Dr. BU and his team, but we're also talking to the elected leaders from whichever region that might be taking place in. Yes, sir.
Okay, that's exactly the scenario in Monroe where you have cases increasing and hospitalizations increasing. Maybe this is a question for Dr. B. But is that because of the testing results were just not coming in, that testing was increased there, or were they not really adhering in that area to social distance?
Well, I mean, I can't know for certain. I don't have any reason to think that the folks in Region 8 and in the Monroe area were less adherent to the stay-at-home than people elsewhere. Not every place is affected to the same degree and at the same time as other places, and thankfully that's so. So when we saw the huge increases in cases in New Orleans and in Jefferson Parish, that didn't play out everywhere, and sometimes you get them later. And I would submit to you that things don't really happen in isolation. And so if you want to look at Monroe and Shreveport, for example, you probably also need to look at Dallas and Jackson, Mississippi, just to see kind of what's happening along those corridors. But Leo, I would point out that there's a net increase of 4 hospitalizations over the last 2 weeks in Monroe. So when you we showed it as an increase because that's where it graphs out, but it's a net of 4. With respect to cases, we believe that the cases are showing up because the testing is increasing. And by the way, we're going to greatly increase our testing capacity in Northeast Louisiana over the coming couple of weeks, especially in those rural Delta parishes that we have over there. Yes, sir.
Going back to the spiking cases, you kind of talked about, depending on where they are, I know moving to this phase one, you talked about not wanting to do a regional approach. Or if some things maybe have to close down or more restrictions go in place, depending on the spikes, could you be looking at a regional?
Yeah, I think it's entirely appropriate to consider, and of course we don't have it yet in front of us, and when we do, we'll look at it. If we ever have to slam on the brakes in terms of easing the restrictions, and it might be that we do that by region as opposed to the approach that we've been taking thus far, which is to do things at the statewide level. And again, I feel comfortable with the approach to do this at the statewide level, and I would tell you that if you pull out the phased guidance from the White House, from the CDC, that we do meet the requirements to go to phase 1. And there's no doubt, whether you look at the information in Globo or by region, we're much better off today than we were a couple of weeks ago. It's a conversation that I had actually on Saturday with the Vice President, and again today at a video telephone conference. But also I was able on Saturday to talk to Dr. Fauci and a separate conversation with Dr. Giroir. And Admiral Giroir is over testing for the country, and he reaffirmed the absolute commitment that the federal government has to resource our testing plan to get to 200,000 tests per month for May and for June, and really going beyond that as well. All of that played into to the decision that we have. And I'll tell you, if you look at the data that Dr. Bio presented, and the overall trends are positive for the state of Louisiana. And I think it bears mentioning because it's, in some ways it seems like yesterday, and some ways it seems like a year ago. But it was just several weeks ago that we had the highest growth rate in cases in the country here, and really in the world, according to Dr. Wagner. We were number 2 in the U.S. in cases per capita. And clearly we had a hot spot that was unrivaled in the country, in New Orleans and Jefferson Parish. Since April the 27th, the number of COVID patients in our hospitals is down by 373. The number of patients in our hospitals on ventilators with COVID down 105. And that said, I agree with Dr. Bu. We're not declaring victory. This is not mission accomplished. And we still have our eyes all over the state of Louisiana. We're going to be monitoring this very, very carefully. And we have particular interest in monitoring what's happening along the I-20 corridor between Shreveport and Bossier on the one hand and Monroe on the other in regions 7 and 8. That will be a particular focus, and I think Dr. B, you mentioned this, of our testing efforts across that I-20 corridor, so we can monitor it very closely, and our contact tracing efforts. It's important that people understand, though, that while we're easing restrictions, and I just mentioned it, it's not mission accomplished. We're not declaring victory. There's still COVID out there, just like there is all over the country. And we really need people to wear that mask when they're out in public and they're dealing with people who are not part of their immediate household. We need them keeping that physical social distancing of 6 feet away from others. We need to make sure that they're washing their hands frequently, soap and water. And if there's one thing that's critically important, it is that literally, even though I don't have a stay-home order in effect come Friday, people who are vulnerable, this really shouldn't make much difference to them at all. If you're 65 or older, if you've got these chronic comorbid conditions like hypertension, diabetes, kidney disease, heart disease, obesity, you really need to be extremely careful and stay home unless you're doing something that really is essential. And I would just remind people that in addition to being safer at home, everybody still has their part to play. And I know this isn't easy, and I know it isn't comfortable wearing a mask, and I suspect as we get into June and July and August, and it's going to get really hot. But it is incredibly important for people to do that, because we don't want to have to go backwards. The worst thing we can do for our economy is to have starts and stops. But if we're going to open up more of our economy, get more people back to work, get more people in our stores and in our restaurants and so forth, we have to practice these things. Otherwise, we don't really have, and not just us in Louisiana, but this is key for the whole country. We don't have a whole lot of other tools in the toolbox in order to keep the case count down outside of the testing and the contact tracing. So we need people to do their part. And by the way, I think the people of Louisiana will do that. I'm reminded that of all the commandments that were given to us, Luke chapter 10, other than the most important one, loving the Lord with all your heart and so forth, is loving your neighbor as yourself. One of the ways you can love your neighbor as yourself is to wear that mask and protect your neighbor from yourself, because there is still a substantial number of people out there with COVID who don't know they have it. They don't know they have it because they're asymptomatic. An asymptomatic person, by definition, feels like they're healthy. So you can't say, I'm not going to wear a mask because I feel good today. That really defeats the purpose. And so I'm asking people to wear those masks. Got time for a couple more questions. Yes, sir.
Governor, can you talk more specifically about what criteria we're going to have to meet to enter phase 2 on 5th or whatever the date is, and also what phase 2 might look like? For instance, bars reopen, is it going to look a lot like what the White House started with?
Sam, I am not going to talk about what phase 2 may look like. It would be very consistent with what's in the White House plans. But there's only so much information we should put out on one day, and we're asking people to focus on phase 1 right now. And as we get closer to the decision on what phase 2, whether we're going to get to phase 2, then we'll start talking about phase 2. But the criteria remain the same. You just have to keep making the same progress. And when it comes to COVID-like illnesses being reported to the emergency rooms, cases, either as a raw number or as a percentage of tests, and hospitalization capacity. All of that has to be trending in a positive direction for 14 consecutive days. So the analysis looks very similar to what we just went through. And because you have to have 14 days worth of data to look at, it seems prudent to me to put this order in place for 21 days so we can collect the 14 days and then take a look at it.
I guess I'm just wondering how you might define a rebound, because the White House says you want no evidence of a rebound. I don't know if you have specific numbers you look at.
Well, first of all, we will continue, as we always have, with questions like that, to reach out to the CDC for their guidance and what it is that they might be looking for and how they would measure it and so forth. We will explain that when we get to it. I just don't feel the need to do it today, but we'll explain it when we get to it. Yes, ma'am.
Does the modeling suggest what the spike in cases, what spike in cases you should expect based on moving into phase one? And what kinds of spikes are considered acceptable spikes in light of the fact that more businesses are reopening?
Yeah, you know, I don't know that we've been told that if we go to phase one as the White House plan envisions it, as per the CDC guidance, we're going to see a spike in cases of this percentage over this period of time. And I don't know that they can be very precise, but I can tell you this: everything that we're doing, we believe is safe, so long as the people do what we're asking them to do with wearing the mask and keeping the 6 feet distance and washing their hands and staying home if they're sick and making sure that they understand that if they're vulnerable, that nothing really should change for them. You know, if people will do those things, if the employers will reopen their businesses and do so in a manner that's consistent with the guidance that they've gotten, we don't have to see a surge in cases at all. Now, I understand enough about human nature to know that not everybody's going to do what we're asking them to do. So the degree to which we're going to be successful will depend in large part on how many do it. We don't know, but I mean, every single time that I talk about this, I talk about the importance of doing these things that are CDC recommended, that are kind of common sense, and that make a big difference as to whether we keep those cases down. But you know, Alex, I'll just ask you, in terms of what kind of spikes we're expected to see because we go to phase one, I don't know if you've received any information from CDC or any other modelers out there as to what that would look like. Yeah, come on.
Well, and I didn't necessarily mean from CDC. I mean, the state is running its own models. So I'm assuming you're building in the phase one expectations into the modeling to see what you are expecting in the loan.
So our models that we've been operating in the department have not modeled what does it look like to open and have contact tracing. We had worked with Johns Hopkins, though, to look at those scenarios. And what they showed was really it's dependent on how effective the contact tracing is. Some of that is on the department. Can we get enough contact tracers out to reach people? Is the testing adequate to meet that demand? But again, a large component of it is how do people then react and respond to contact tracing? Are they helping us as we reach out, find people who could be exposed? Are they themselves adhering to isolating if they have COVID? Are they quarantining if they've been exposed to someone with COVID? What they modeled was looking at an example, a shining example of how effective that can be in that South Korea. And you know, we know that it'd be very challenging for us to be as effective as South Korea was in contact tracing. And so what we're looking at is how effective can we be? And that's hard to predict. Again, models don't predict, but what they told us is if we're not very effective, if we don't have adherence and participation in contact tracing, we should expect that there would be a challenge and that we would see a growth in cases again, and that we would have you know, the same kind of picture that we had going into this. And that's why we keep emphasizing how important it is. There's only so much the state can do. We really need everybody to do staying at home, wearing a mask, and adhering to quarantining if you're asked to, because that's how we're going to stop the spread, put a ring fence around COVID cases as they develop, and keep them from spreading in our communities. So that's at least what I can say about the modeling.
Last question, everybody.
And I think, Melinda, to further answer your question, it is possible when you look at the cases that are developing, especially as a percentage of the tests given, and at hospitalizations over time, you can predict the rate of transmission, the R naught, and kind of know where it is based on that. And so we know that as a state right now where we are, we know it. I say when we know it. The models tell us where we think we are at the state level and each region, and we're going to continue to look at those numbers as we move forward. And so when the R naught, if it should increase, we will take a look at that. And see how significantly increases and so forth. All right, I've got one more. Well, no, I'll go ahead and do two more. Leo and then Greg.
Okay. Many parents are asking when can daycare
Well, about 30% of the daycares never closed. And so they will be reopening with guidelines as they are able to do it, coming through the Department of Education in partnership with the Department of Health. But I want to say the last report I got on this from Interim Superintendent Vecino, about 35% had never closed. Now they may have taken in fewer children and focused on the children of healthcare workers and that sort of thing, but about 35% never closed. Yes, sir, Greg.
Governor, as you know, the REC accepted a forecast of $1 billion or more hole in the upcoming budget for the next year.
Yeah.
Are your expectations that the lawmakers pass a budget by June 1st? Or are you, there's been some talk of them moving past that special session, see if there's a federal rescue? What are your thoughts on that?
Well, I don't think we're going to know anything more in the month of June than we're going to know in the month of May. And so I would hope that while we're here in a regular session, that we do the essential work that the legislature has to do, and part of that is passing a budget. And the number for next fiscal year, based on the LFO forecast, which is the one that was adopted, I think is $867 million. That is a very challenging number, even with the CARES Act money that we have, even with the rainy day funds that will be available next year, and even with the FMAP enhancement that the federal government has given, and that's the percentage of the Medicaid program that the federal government will pay. So there's a 6.2% kicker there. So even with all of those things, it becomes a very challenging budget. But there's no reason at this point to believe we're going to know more in June than we know now. And so I would encourage them to pass a budget. And no matter what we do preparing for next fiscal year, I think it's a pretty good bet that we would be coming back in October after an REC meeting to make adjustments to the budget for the remainder of the fiscal year. But we do need to adopt a budget so that come July 1st, we can keep the government in operation across the state of Louisiana. But no doubt it's a very challenging situation. And I do hope that something, either the Cassidy-Menendez bill or something like it will get passed. It's one of the things that we talked about today with the Vice President. We spent a lot of time on that. The governors all around the country, and he certainly expressed an openness to it, as did the Treasury Secretary, and thought that that might come into focus much more over the next couple of weeks. It would be very helpful if that happened. Look, thank y'all very much again for coming out. We're scheduled again for Wednesday. Is that right?
Yes, 2:30.
Wednesday at 2:30, right here. So appreciate y'all covering this, and I want to again tell the people of Louisiana how much I appreciate them for the patience that they've shown, for the compliance with the stay-at-home order, to put us in position where we can enter phase one, and I think do so safely. But whether we get through phase one safely really depends on continued compliance with all of these mitigation measures. We are not back to life as we knew it before COVID-19. There is a new normal in place, and everybody has a role to play, and I'm asking that you play that role. It's extremely important if we're going to be successful and not have to go backwards in terms of putting more restrictions in place, which is the worst possible thing that we can do for our economy. It's the worst possible thing we can do for our workers and so forth. And so we are asking everybody to comply with the order. We're under the stay-at-home through the end of this current proclamation period, but on this Friday, May the 15th, we will move to phase one. Please make sure that if you've got questions that you ask, get those questions answered this week, so that you can proceed on the 15th with the new order. God bless you, and thank you so much.